Mm.
Yes, Papa.
Today we will discuss an important topic like breastfeeding and breast milk and protein energy malnutrition. So, what is the cardinal principle of breastfeeding? It should be initiated within 1 hour after birth. It is very important. Now, WHO recommends exclusive breastfeeding during the first 6 months of life. Exclusive breastfeeding first 6 months of life, except vitamin drop where indicated. It has the potential to reduce under 5 mortality rate 13%. Exclusive breastfeeding up to 6 months. Now, what is the weaning and complementary feeding? It should start by 6 months of age, and breastfeeding should be continued up to 2 years. So, after 6 months, complementary feeding we may start, but it should be continued breastfeeding up to 2 years. So, now what are the special features of breast milk? This is very important, but in nutshell, we will discuss that the protein content of the breast milk nearly 60% whey protein, largely lact albumin and lact globulin, which are easily digested. So, uh, casein only 40% casein. In cow's milk, casein is the main protein. So, difference between milk and cows we will discuss later on. So, mm anti-infective in breast milk, it is important. What are the anti-infective? Antimicrobial agent, macrophage, lysosome, complement, immunoglobulin, A, secretory IgA, protect respiratory and GI tract. Now, PABA, para amino benzoic acid, protect against malaria, PABA. Lact, lactoferrin, bacteriostatic against enterobacteria like E. coli. Peroxidase kills bacteria, and bile duct stimulated lipase. It lyses amoeba and giardia. Bifidus factors help to colonize lactobacillus bifidus, which help in digestion. And others, breast milk also contain IgA, lysosome, bifidus factor, interferon, everything. So this is very important. So different anti-infective agent in the breast milk, antimicrobial agent, PABA, lactoferrin, peroxidase, bile, and bifidus factors. Breastfed baby is likely to have an IQ of 8 points higher than that of the non-breastfed baby. This is important. So IQ also breastfed milk 8 points higher than the non-breastfed baby. So now what are the composition of breast milk? Colostrum. Colostrum contain. It is secreted during first 3 to 4 days after delivery. Yellow color, thick, contain large amount of antibodies and vitamin A, D, E, and K, but it has less fat and sugar. So colostrum important. Now transitional milk from 3 to 4 days up to 2 weeks after delivery. Here fat and sugar content increased, and mature milk thinner and watery. So three components: colostrum, transitional milk, and mature milk. One is preterm milk, foremilk, and Hindmilk. So these are the all categories of milk. Depends on the constituent, less or more. So in mature milk, there it is thinner and watery. But in preterm milk, milk of mother who delivered before 37 weeks. Now, two important things is foremilk and Hindmilk. What is foremilk and what is Hindmilk? Foremilk secreted at the start of feed. It is watery and rich in protein. So, foremilk is watery and rich in protein, sugar, mineral, vitamins, and water. Then quench the baby's thirst. So, first milk, that is foremilk, contain more water and rich in protein. Hind milk secretes at the end of the feed, and it is richer in fat. Therefore, it provides more energy and gives a sense of satiety. So, satisfied baby's hunger. So, two milk, foremilk, and Hindmilk. Foremilk watery, Hindmilk fat. Now, the difference between milk, cows, and breast milk. So, higher than cow's milk. Cow's milk से breast milk में क्या क्या higher रहेगा, ज्यादा रहेगा. So, lactose, lactalbumin, lactotransferrin, immunoglobulin, lysosome, and carbohydrate, especially lactose, iron, vitamin C, D. So, these are higher than cow's milk. एंड लेसर इन ब्रेस्ट मिल्क क्या क्या रहेगा, कम ब्रेस्ट मिल्क में प्रोटीन कम रहेगा, फैट एंड मिनरल कैल्शियम फॉस्फेट सोडियम कम रहेगा. नाउ goat's milk is deficient in vitamin D and vitamin B12, iron and folic acid. So goat's milk, you remember that goat's milk is very important in case of dengue. Nowadays they use for increased platelet count. But goat's milk is deficient in vitamin D, vitamin B12, iron, folic acid. Hence, megaloblastic anemia may be seen if exclusive goat's milk is given. So this is very important. Goat's milk we are using in some rural places.
Yes.
So, uh, so
Also, we are
in nutshell,
giving kiwi and platelet papaya extract, leaf
papaya,
extract.
papaya can also give. We there is now the tablet comes with goat meal, papaya, everything.
Everything
So
mixed.
mix, yeah.
Yes.
So this is goat's milk, which is deficient in folic acid, vitamin B12, vitamin D. So there
हाँ,
is more chance of
yeah, I would like to address one issue. न्यूबॉर्न बेबी कोई भी रहता है ना, तो उसकी जो दादी और नानी रहती है, वो हमेशा क्या करती है कि वो बोलती है कि नहीं, बच्चा का मुंह में कुछ मीठा होना चाहिए, तो वो क्या करती है, थोड़ा सा हनी लेके टच करा देती है,
हाँ.
जीभ में टच करा देती है कि भाई कुछ मीठा होना चाहिए, कुछ समथिंग स्वीट.
मीठा हो जाए मीठा.
अब उस
या.
चक्कर में क्या होता है कि वो हनी जो है, वो उसके पेट में जाके गैस बनाएगा, प्रॉब्लम क्रिएट करेगा. और फिर कुछ दिन बाद
हम्म.
मदर जो है वो लेके आती है कि बच्चा, मेरा पेट फूल गया है, बच्चा रो रहा है, बच्चा
हम्म.
का प्रॉब्लम हो गया है.
हम्म. हम्म.
तो
हम्म.
दिस थिंग्स लाइक जो प्रैक्टिस में लगातार आते चला था, उसमें ये हनी जो है, मतलब
हम्म.
ब्रेस्ट मिल्क का इतना इंपॉर्टेंस है कि हम लोग को तुरंत देना है. ये इवन जो
हम्म.
मतलब पेशेंट्स को, इवन लाइक उनको बताना होता है कि भाई आप लोग को कुछ नहीं खिलाना है, वही
हाँ
चीज है.
हाँ. नहीं तो अभी जो है आंगनबाड़ी वर्कर जितना है,
हाँ.
जितना आशा, आशा जो है, ये लोग जो है, ये लोग को स्पेशल ट्रेनिंग दिया गया है कि भाई बेबी डिलीवरी, होम डिलीवरी करना नहीं है. होम डिलीवरी होगा तो स्पेशल ट्रेंड नर्स से कराना है. और इंस्टीट्यूशनल डिलीवरी के बाद क्या ब्रेस्ट फीडिंग करना, क्या कैसे करना है, वो चीज सारी वो लोग को ट्रेनिंग देता है. तो
राइट, राइट, राइट.
आजकल हानि का कम हो रहा है. आजकल
हाँ,
ब्रेस्ट
बहुत कम
फीडिंग
हुआ है.
ज्यादा जा रहा है.
हाँ.
कुछ लिटरेट हो रहा है
हाँ.
क्योंकि आशा इन लोग को पैसा मिलता है तो ये लोग अपना करती है. ये लोग का टारगेट रहता है कि
हाँ.
कैसे करना है. अगर कुछ होता है दे आर रिस्पॉन्सिबल फॉर दैट.
फॉर दैट,
If
वही.
baby is suffering for anything, so they will suffer from that.
राइट, राइट, राइट.
So this is very important. So in nutshell, breast milk contain 7 gram percent carbohydrate,
राइट.
6 gram percent lactose, and protein is less in breast milk 1%, and in cow's milk 3%.
ओके.
Okay.